In this year's AORTIC 2021 conference, I'm going to present on the resources that are required for managing immune-related adverse effects in our part of the world. As you all must be aware, immune checkpoint inhibitors or immunotherapy is the current new treatment that is in the market, and it is currently being utilized. Immune therapy in the past, since it discovered in some mid 2000s, it is now approved for 19 cancers, and out of those 19 cancers, 2 of its indications are agnostic. That means that as long as you have that biomarker, you can use that immune therapy. The basic mechanism of action of immune therapy is whereby it enhances, it sort of dampens the mechanisms the cancer uses to evade the immune system, and somehow enhances the immune system to fight against the cancer. However, because of its mechanism of action, it now presents with a new problems. It presents with adverse effects that are not so common with the conventional chemotherapeutic drugs. And these adverse effects tend to occur because of the immune system activation, and now the immune system targets the normal cells in the body. It presents with some of autoimmune-like adverse effects. And these adverse effects have been clustered together with known as immune-related adverse effects. If these adverse effects are not identified early, are not diagnosed early, they can later prove to be fatal. Most of the adverse effects that occur with chemotherapy, conventional chemotherapy drugs, tend to occur almost immediately with when giving the chemotherapy drugs. Hence, we can correlate temporally that the person got these adverse effects because he or she had been using this chemotherapy. However, with the ones with the adverse effects that occur with immune-related adverse effects sometimes tend to occur maybe weeks or later, or maybe months later after using the immune therapy, and sometimes it may not be easy to make a temporal relationship with the use of immune checkpoint inhibitors and the adverse effects. Often not, the immune checkpoint inhibitors tend to come in the market around the early 2005, where they were initially used as salvage therapy, as as second line or third line therapy. However, these drugs in the past decade have been slowly rising the ladders, and now are being tested in first line therapy for early cancers, and sometimes they are used in combination with the conventional chemotherapy drugs, or they are used in combination with other tyrosine kinase inhibitors. And sometimes some of these adverse effects may overlap. For example, if using most of the tyrosine kinase inhibitors tend to cause diarrhea, and similarly the immune therapy also tend to cause diarrhea. So sometimes it may become difficult to differentiate from which molecule is this adverse effect from. So the resources that are required for the immune-related adverse effects is because these adverse effects tend to affect any part of the body, wherever the immune system works. It tends to affect almost every organ of the body. However, the most common adverse effects that tend to occur with the use of the immune checkpoint inhibitors include colitis, which can present as diarrhea, or it can present with pneumonitis, which can present with difficulty in breathing. It can cause hepatitis, and it can also cause cerebral dysfunction. So it can affect any part of the body, and about a quarter of the patients who are on immune checkpoint inhibitors tend to get these adverse effects. Albeit the treatment of immune checkpoint inhibitors seems to be easy on paper. It looks simple on paper because it basically involves the use of corticosteroids. And if patients do not respond to corticosteroids, they tend to get other immunosuppressive drugs such as infliximab, etc. Albeit the treatment looks simple on paper, it is not so simple to treat these conditions. So the sum of the before we go the resources that are required for a patient to manage these immune-related adverse effects, we need to identify the challenges that are associated with immune-related adverse effects. These challenges can be classified or can be categorized into four major groups. The first one is physician awareness. The second one is diagnostic complexities. The third one is patient's awareness. And the fourth one is lack of research into these adverse effects. If you look at physician awareness, these immune-related adverse effects, very few physicians are aware of these conditions and how they can present and what treatment is required. Albeit, this treatment requires both the oncologist and the non-oncologist physician to be aware of these adverse effects. There are a couple of studies that have been done looking at the knowledge gap of these adverse effects within few medical students who are currently rotating in the medical wards, and also rheumatologists. And it was found that there appears a major gap of people not knowing what these immune-related adverse effects are and how they can be managed. Immune therapy is now being inculcated in the immune therapy, and the lectures on immune therapy are now, the syllabus is now being inculcated in the current syllabuses. So patients who are, or physicians, or oncologists who are older, who may not have experience, may not even know about these immune-related adverse effects. And this study has been done on students who are currently rotating or learning about, or rotating in the doing their internal medicine residency. So, because it sometimes happens that because immune checkpoint inhibitors is a novel therapy, it might be given in some centralized hospital in an urban setup, and the patient may be coming from a rural area to get his or her treatment. But whenever he gets one of the commonest adverse effects is getting diarrhea or colitis with these drugs. It is very possible that when the patient will get colitis, he or she will not come to that central area because that central hospital or reference lab may be very much far away from his or her place and may seek help in a nearby local facility. And there's a possibility that the doctor there may not know what are the causes of her diarrhea and may end up treating her for another cause of diarrhea, and at all not thinking that this could be an adverse effect of immunotherapy. So one of the resources that are required is to understand, is to teach, is to appraise and to teach and to make aware both the oncologist and the non-oncologist physicians on this entity called immune-related adverse effects and how this can be treated. The reason the non-oncology physicians or the non-oncology doctors need to know about these conditions is because, as I mentioned earlier, immune-related adverse is a systemic disease. It can present as diarrhea, colitis, it can present as pneumonitis, or it can present as endocrinopathy like hypothyroidism, or any other neurological symptoms. Hence, you need to involve these other specialties in assisting in the treatment of these patients. Because if a patient gets colitis and is not responding to treatment, then you may need to go to an gastroenterologist to come and do for you a colonoscopy. But this is one of the biggest challenges. The physicians are not aware of this entity, and hence some resources have to be put in place to make these physicians, both oncology and non-oncology, to be aware of these conditions. The second major challenge that is with these conditions is diagnostic complexities. So in cancer treatment, if a patient presents with, I'll mention more about diarrhea because it's one of the most commonest adverse effects. You have to rule out other causes of diarrhea, infectious causes, other non-immune-related causes of diarrhea. And because in Africa, infection still plays a major role in diseases, we need to look out for these infectious causes. So if a patient presents with diarrhea, he or she needs to undergo some battery of investigations and tests to rule out other causes of diarrhea. Similarly, if he presents with hepatitis, whereby the liver is deranged, he or she will require to undergo some other battery of tests so as to rule out other causes of hepatitis that are still common in Africa and other parts of the world. So this requires a battery of investigations, and hence resources need to be put so as to provide patients with these other tests so as to rule out other causes of treatment. Because as I've mentioned, if the cause of the diarrhea or the cause of hepatitis is infectious, and you now tend to give them immunosuppressant drugs such as corticosteroids, other immunosuppressant drugs, then you will tend to worsen the infection and may cause more harm to the patient. The third major aspect is the patient's awareness. The patient has to be educated on what the treatment is and what are the few of the adverse effects that are associated with this treatment. Patients may be aware of the usual hair loss, skin changes that come with nausea and vomiting that come with the conventional chemotherapy. And most, if the patients go into the internet, they most probably tend to get these as the side effects of the possible drugs. However, these drugs do not tend to cause such side effects. They tend to cause some unique side effects, and these side effects, as I've mentioned, can come even later in therapy. So the patient has to be made aware about it. He or she needs to carry with her a wallet, immunotherapy wallet or wristband, informing that she is on this immunotherapy, and if she has this symptoms of this or this problem, she should contact so and so. Or even if she goes to a nearby hospital, she should mention to the doctor that I am on this therapy and this adverse effect can be because of that treatment. She needs to be continuously be made aware, and patient education starts from the time she visits the nurse, the facility. The nurse should educate her, the doctor should educate her, the pharmacist who's dispensing the medicine should educate her, and also she will currently be informed about it. So that's basically patient's awareness. Some of the studies that have been done say most patients are not aware of their side effects, and some of them tend to learn as they go into treatment. Number 4, so resources have to be put in place so as to educate these persons on what immune therapy is, how does it work, and what are some of its adverse effects. The fourth challenge that was identified is lack of research in this area. Most of the current knowledge regarding immune-related adverse effects has been from observational studies, retrospective studies, meta-analysis, and there have been not such higher evidence regarding these studies. Unfortunately, in Africa, as I was going looking about the topic, I only found one study about immune-related adverse effects, and hence there's a very big gap about lack of studies both in the use of immunotherapy and also in the immune-related adverse effects in this patient. So we need to collaborate with North and South, East and West, and come up with good evidence on what is the burden of immune-related adverse effects in Africa and how can we manage them accordingly. Are steroids the only drugs available, or there can be other drugs that can be used? And most important is how do we need to prevent this adverse effects? So that's a major challenge on how we need to increase on research and to understand more about this drug, especially for our African population, because most of the trials that have led to approval of these drugs in the treatment of cancer have a very minute representation by African population. And so that are basically some of the challenges that are facing and some of the resources based on these challenges that we require to 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 to, to treat and to mitigate the effects of immune-related adverse effects. So we can so when the time is, so I know that if I prescribe this immune checkpoint inhibitors and my patient who's staying like say 300 kilometers away from me gets a diarrhea and she goes to a nearby facility, she will get the appropriate care and the necessary treatment so that she does not have further mortality or she does not have further harm or even mortality based on a misdiagnosis of an immune-related adverse effect. So the crux of the matter is what we basically need in Africa, when the major resource that we need in Africa is we need to do more research and we need to do more studies into see how these immune-related adverse effects are, and then we need to start inculcating and teaching our fellows, our residents, our colleagues on these immune-related adverse effects. Thank you very much.